Welcome to SCR Connection. Thank you everyone for joining us. It is my pleasure to introduce our guest speaker, Dr. Lynn Connaway. Dr. Connaway is the Director of Library Trends and User Research at OCLC Research. She is the co-author of the 6th edition of Research Methods in Library and Information Science published in 2017. She leads OCLC Research in the Digital Visitors and Residents Project and currently is the co-PI of an IMLS funded project with the University of Florida, Rutgers, and the State University of New Jersey to investigate how late primary, secondary, and community college STEM students judge credibility of digital resources. In today's SCR Connection, Dr. Connaway will give a presentation on how public libraries respond to the opioid crisis with their community. Thank you, Dr. Connaway, for being our guest speaker this morning, and I'll return everything over to you.
Thank you, Edward, and thank you all for joining us today to hear about our research on how public libraries respond to the opioid crisis with their community. I'm going to stop my video now, but I just wanted you to see that I am a live person. So again, thank you for joining us, and I will stop sharing, and I will share my screen right now. Did that work at all?
Yes, you just, Dr. Connaway, you just need to go to the first slide and then start the presentation.
Okay, because I'm not seeing it, sorry, like we did in our, anyway. So I want to start with, I think, a staggering statistic that more than 128 people die in the US every day from an opioid overdose. That's almost 40,000 people a year. Overall, drug overdoses killed more than 76,000 Americans in 2018. So in the past year, with the challenges introduced with COVID-19 pandemic, things have gotten much worse. The Centers for Disease Control reported that in June, and this was a survey panel that they did, 13% of respondents reported they started or increased substance abuse to cope with stress or emotions related to COVID-19. And it seems reasonable that as the effects of the pandemic continue, that this number will continue to increase. Several states also reported dramatic increases through March 2020. I just saw on the national news yesterday that some states have reported that the opioid deaths have increased almost 100%. Now, I tried to find those data on the CDC and I could not. So anyway, I was looking because I live in Colorado, and the state of Colorado was one of those states where the opioid pandemic has drastically increased. More than 20% of patients who have been prescribed opioids misuse them. And the Centers for Disease Control and Prevention has estimated that misuse of prescription opioids cost $78.5 billion a year. So this is the cost for treatment for those experiencing addiction, emergency services for people who overdose, and policing efforts. So this is a massive problem in the US, as you all know, and it is impacting people deeply. It is very difficult at this point not to know someone who has been affected by this crisis. People have lost their children, their parents, their friends, or they know someone who has. It is simply devastating. And during our research, when I interviewed some social workers, the concern with some of them is that there are some other crises that are happening that we are not really addressing. And one is the crisis with the overdose and abuse of methamphetamines. And when I talk to these individuals, they thought that we should be looking at these issues as well, but that opioid addiction is much more popular because it has affected all socioeconomic levels and all educational levels. And so it's something that we want to tackle, where methamphetamine overdoses and addictions are often looked at as lower income people. So that's something else we should be thinking about with all of this. So you may be asking, what does this have to do with libraries? And I just want to show you a few headlines from news media in the US about the impact that this crisis is having on US public libraries. Over the past few years, stories like these have been common as communities face the realities of opioid addiction and overdose. And libraries certainly have not been spared. And headlines like these, as well as ongoing concerns and questions raised by library staff and all the places that they meet, such as the conferences and meetings, as well as in the online spaces through listservs and emails, prompted us at OCLC and the Public Library Association of the American Library Association to look at how we could capture and share how libraries are responding to this opioid crisis within their communities. Now, these concerns really sparked the origin of this project. And what we heard from library staff prompted us to OCLC to partner with PLA on offering a free online town hall in September 2017. So we've been working on this for quite a while. This was open to everyone, and it was an opportunity to hear about this crisis and how it was impacting libraries. We invited speakers ranging from library staff who were creating responses to community partners who had suggestions and ideas for approaches to share their ideas. The words on the screen were some of the most common that surfaced in the chat between participants. You'll note the focus on things like training, staff, and community. These have also come up in our research addressing how libraries are coping with the COVID-19 pandemic. So this is something that we need to really look at as individuals in libraries. You can also see terms like fentanyl, which is often combined with opioids and can be deadly, as well as naloxone and its name brand Narcan. So from this webinar, OCLC and PLA decided that we needed to and wanted to do more to address these concerns in the community. So we partnered together on a project that we called Libraries Respond to the Opioid Crisis with Their Communities. And so, as I said, the partners are OCLC. If you don't know OCLC, we are a global library cooperative. We are governed by our members, and we provide technology services, research, and learning programs. The Public Library Association is the largest association dedicated to the needs of public library professionals in the US and Canada. And so together we have the capacity, reach, and networks to research, synthesize, and disseminate project learnings to strengthen libraries and their role within the community. And so the funder of this project was the Institute of Museum and Library Services. I'm proud and happy to announce that this project and the project team was recognized as the recipient of the Connie Van Fleet Award for Research Excellence in Public Library Services to Adults in October 2020 by the Association for Library and Information Science Education. So this really meant a lot to us and says a lot about this research and how important it is. I want to start talking about what we learned. At the core of this problem are people in our communities who are dying from opioid overdoses. And that's the concern that we had heard as we embarked on this journey for this project. There's also the impact that this has on the family and friends, the people who love this person, who has an addiction, who has died from their addiction or an overdose. And this is a community-wide problem, and it requires community-wide responses. And this on the screen is a quote from a community partner director who we interviewed. And so community partners could be social services, it could be police departments. So we interviewed partners who worked with the library staff on addressing the opioid crisis within each community. So our project goals were basically threefold. And so the number one was to help public library directors and staff to make informed decisions about strategies, policies, and activities. And we wanted to take what we learned from the experiences of others and then promote these lessons learned to strengthen the efforts of others. And as a profession, libraries are extremely generous when it comes to sharing their ideas and resources. And we really aim to capitalize on that to help others more quickly develop their own responses to this crisis. It's something that comes up very often. And the words we often hear is, how do we avoid reinventing the wheel? So what we wanted to do in this project is to identify and share what others have learned so that other library staff can just pick up and adapt to their communities and their needs. One of the requirements from this research is that the libraries that we are profiling are all involved in supporting their community with the help of local partners. So they had to have a local community partner to be even considered to be a part of this project. And what we're hearing is that the idea of partnering with libraries to meet community needs isn't always at the top of the minds of these other community partners. And that we really want to work to change that. We want to encourage the inclusion of libraries as key partners within the community. This results in stronger coalitions and networks. We want libraries to have a seat at the table in addressing these issues that have deep impact on the community, such as the opioid epidemic. There always will be another issue on the horizon, something else that we need to be engaged in and respond to. And this just happened this year with the COVID-19 pandemic. So as we go further, if we do this together, it really makes it more easily attempted and more easily able to address. And while partnerships aren't always possible, and it could be for a lot of reasons, time, the subject matter, even location, when it works successfully, it really means that we can equip libraries and their partners to deal not just with their current needs, but with future challenges as well. And so the development of relationships and infrastructure that can support changes and needs is something that can live well beyond a single project or activity. And we really need to think about how we invest in infrastructure that can benefit us in the years to come. So these were our project activities. So we had several phases. We had case studies, 8 of them, in libraries from September 2018 through August 2019. And I led this initiative. So I led the research part of this project. We also had cross-sector discussions. So we had these discussion groups with not just librarians and library staff, but also other community agencies and community partners. We wrote a call to action white paper, and we've been disseminating this information to the field, and we have done that in multiple ways. So for the case studies, as I said, we had 8 of them, and I want to really focus on that today. So the criteria that we used for the site selection was, number 1, to find a diversity of communities by size, region, geographic distribution, and demographics. We also were looking at the diversity of the population that the library served. And then we also looked at health data, so uninsured rates, opioid prescription rates, drug overdose deaths, and mortality rates. And again, I can't stress this more. These library staff must have worked with community partners on programs or services related to the opioid crisis. So, and they also had to represent a range of community interventions. So what the challenge we had in finding these case study sites was finding libraries serving smaller communities which could meet these criteria, such as working with a partner. And the case studies include libraries that serve communities of just more than 16,000 people to way over 800,000 people. So they represent a range of different resources, different staff, and different communities. This is a map, and this depicts the case study sites. So you can see we tried to get to different regions of the United States. Again, the methodology was case studies. So we actually went on site for a day and a half to 2 days to each of these 8 sites. We interviewed up to 9 individuals in each site. So the library director or deputy director, the library administrators and managers, library frontline staff, community partner directors, community partner frontline staffs, and community members. So up to 3 per location. And so the interviews were transcribed. We also had someone taking notes, and then they were coded into NVivo, which is a software program for qualitative data analysis. These are just some examples of the interview questions that we had. And so the questions had to be different for library staff, library boards, community partners, community members, and library administrators. And so with most interviews, we had no more than 14 main questions, but we also had prompts so that we could get more involved and ask more questions and dig deeper into some of the responses. Most of the interviews with library and community partner staff lasted about 45 minutes. Interviews with community members were about 15 minutes or so. However, they varied. I had one interview with a community member who was the recovering addict, and that was a 2-hour interview. So through our research, we identified a range of programming and services. And what is key about this to the project and to the library field, as this is a range of activities and options that librarians can choose to implement. There is no one size or prescription for all on how to handle this epidemic or pandemic. Each library has a different community and different needs. So what fits one will not necessarily work with others. My mother worked in retail for several years, and she always says that one size fits none. And that's what I have to say about what we learned as well. Now you can see that we organize the information about the types of programs and services in different ways. And unsurprisingly, programs and activities work best for both the library staff and the community when they're a natural extension of what the libraries do well in their communities. So many of the interviewees for the project felt that their response was aligned with the information needs of their communities, which again, I cannot stress enough. And the next few slides represent examples of the types of programming and services that we found in the libraries that were part of these case studies. What you're looking at now is an overdose rescue kit. And this is courtesy of the Peoria Public Library. And you can see it contains several doses of Narcan, which is the opioid overdose reversal drug, naloxone, which can be administered to someone to revive them from an overdose. It also includes instructions for using the Narcan and what to do to get more help. I was conducting the case study in one of the large metropolitan libraries. And while I was there, I was talking to the social worker who was working in the library, and she got a call, and they're actually, right when we were talking, an individual had an overdose in the library. And they did have the Narcan available, and the individual did survive and was taken for medical attention. This is a large display right at the checkout desk of the public library in Salt Lake County, Utah. And this is an example of encouraging the community to both recognize what an opioid can look like, as well as to increase awareness about the potential hazards. And you cannot miss this display if you were in the library. And it sparks conversation with users as well as in families. And the staff noted that children have asked about the candy in these pictures. This is a good reminder to parents that children often don't realize that a pill is a potentially dangerous medication. This to me was the most overwhelming and impactful display. This is another example of this public awareness campaign at the Salt Lake at the Salt Lake Library System. Hanging from the ceiling when you enter the library is 7,000 paper pill bottles, the kind that you would get a prescription in from the pharmacy. So this represents the 7,000 prescriptions for opioids that are written every day in the state of Utah, every day. In 2017, there were 650 drug overdose deaths in Utah. This display and the one on the previous page were funded entirely by the library's partners at the health department. The library did not need to pay for anything, but they did provide the space to make the display possible. And every day, hundreds of people walk through the doors of this library and can see these displays and have an opportunity to learn about how the opioid epidemic is affecting their community and maybe learn how to protect themselves and the people they love. Now, the New Orleans Public Library rolled out training on how to use the opioid overdose antidote, naloxone, into a training that they offer in partnership with the local health department. The program is called Bystander Training, and it also includes how to perform CPR, how to stop bleeding after trauma. And this approach of including the naloxone training with other common health concerns helps to reduce the stigma of a drug overdose and gives people the opportunity to understand more about how addictions to opioids form and why it is impacting so many people. And the health department provides all of the trainees, of the trainers for these events. And both organizations help to promote the training. The library is scheduling the events in different locations around their systems to help reach more community members. Now, one of the most impactful programs that we learned about is the Denver Public Library's Community Resource Program. This was originally designed to help with users who were experiencing homelessness. And as the opioid epidemic became more prevalent, the library shifted to also work with patrons on opioid-related issues. So they moved very quickly to meet the community needs. A powerful aspect of this Denver program is that it includes the use of peer navigators. And these peer navigators are staff members who have what is called lived experience. They may have formerly experienced homelessness or addiction themselves, and now they have an opportunity to work helping others. They're able to use their experiences to meet people and provide access to services that the library and their partners offer. These peer navigators go out and meet people and introduce themselves and look for opportunities to provide some type of support. Some days this could be with giving them access to a phone to make a call, or it may be connecting them to a local shelter or housing assistance. And sometimes they are literally just someone to talk to with compassion and patience. I shadowed the social workers and the peer navigators for an afternoon at the Denver Public Library. This was really an experience that I don't think I can ever compare anything else to. And it really helped me understand this crisis more than anything, and how it hurts so many individuals within our communities. I won't read to you all of these quotes, but this one to me is one that is just so heartfelt. And this was a part of the interview with a community member. And you can see that this community member used the services for the library. And he says, and for a guy like me who has been to prison, who suffered, struggled with using for a long time, I'm hanging out with librarians, the police, I'm still alive. I still know people that use and I don't use, but I'm still talking to those people. But now there are people that have historically not liked me, people like me treating me like a human and giving me the opportunity to be a human instead of just a junkie. And that is absolutely phenomenal. And that's what we have to try to remember, that these individuals are humans and have feelings. So these are the types of partners that library staff are working with. Their health departments, recovery courts, and other nonprofit organizations. This is another quote from a community, and this is from a community partner. And the community partner is really grateful that the library was helping, but they also are recognizing what the library can provide as far as information and training to help individuals understand and cope with this illness. A few trends surfaced as we analyzed our data. And the first is that the partnerships between the libraries and the other community organizations to bring about this programming were perceived positively. The interviewers reported very few issues and had a mutual appreciation for each other. The second issue is that the partner organizations often note that they didn't think about the library as a partner before the opportunity to work together in the opioid response emerged. There were some exciting relationships, but they weren't very detailed, and the opioid response brought a new focus to the value of working together. And finally, when we talk to the librarians and their partners about how they know that these efforts are successful, what the impact is, they can't provide much information other than statistics on usage. So there's another area that we need to consider for research, is measuring the impact of these programs within the communities. These are, again, some more quotes from interviewees about evaluating the services. And they shared that seeking help for an issue related to opioid misuse can be a highly sensitive request. Again, the stigma attached to drug use is real, and there can be received consequences from individuals who are seeking information, whether it's an individual who needs help or someone who is seeking support for a friend or family member. This concern absolutely plays out in how libraries are collecting information about these individuals using the services connected to the opioid crisis. Interviewees indicated that confidentiality is critical to being able to provide services, which has made capturing any information about the long-term impact of their efforts is very difficult. Instead, we found that more libraries focusing on the number of people served and capturing anecdotal information from staff as it becomes available is the most prevalent. And looking more at the partnerships, some of the advantages that likely won't come as a surprise are outlined here. These are exactly the kinds of things that surface when organizations collaborate successfully. And it is certainly what we are seeing, that we have seen in this project. One of the key parts of this work is that we would like people to see that these relationships won't just serve the needs of the opioid crisis, but rather that this can be something that has a lasting impact as trust develops between organizations who can rely on each other as the needs in the community change. And we have seen this with library staff and other community agencies addressing the COVID-19 pandemic. This quote came from a community member who received training on how to administer naloxone, which can reverse an opioid overdose, as I have said. And this perceived sense of being better prepared to help someone is huge. Knowing that naloxone is available and how to use it can lead to helping someone survive an overdose. This community member also spoke to the importance of being trained and aware of ways that you can help people who are addicted. He has felt this need directly when someone died outside of his church 2 years ago. By participating in the training provided by the library and their partner, he was able to get more information to support his community and possibly prevent another tragedy. And finally, this was shared with someone who had been speaking with a peer navigator who works out of the library. The interviewee shared that the access to a peer navigator makes a difference in his willingness to share his story and to ask someone for help. He valued the fact that the peer navigator has had experiences similar to his own and that made him more relatable to the individual. In the past, he felt that people without that shared lived experience would talk down to him. And he really couldn't understand, and they really couldn't understand where he was coming from and the road that he had traveled. But a peer navigator was someone who had been there and that made a difference to him. Once we completed the case study research and wrote up the findings for publication, we moved to the next phase of the project, which was engaging other organizations and getting their feedback about our project and the opportunity for moving ahead together. Because partnerships are such an important part of this work, we sought out input and guidance from organizations from outside the library field. We also wanted to hear about what is happening in libraries around the opioid crisis and look for opportunities for how we can all work together in addressing the crisis. So in fall 2019, we invited a cross-sector of organizations to participate in an online meeting where we asked the attendees to share their thoughts about the case studies and to share resources from their organizations that they think will benefit libraries and the public. We were able to take their suggestions, resources, and ideas and put them together with our findings in the project's call to action. And these are, this is the call to action report. And it's the culmination of this grant-funded project. And it highlights ways for libraries to engage with the topic as gleaned from our case study research and these discussions with public health and human services organizations, other nonprofits, library support organizations, and government agencies. This report is freely available. You can access it along with the case studies, which are also displayed here, and the summary report on this research. And you can access the call to action report and these other reports on the websites. So just follow the URL and you'll find the link. And so this is the call to action of the research findings, and it lays out steps that library staff can take to not only support the community through the crisis, but also to help staff and other stakeholders learn the facts about the crisis and find a role for the library to play in addressing this important healthcare issue. We hope that what you've heard today will inspire you to take a look at the paper and seek ways for your library to respond. And remember, the power of partnerships in this response. You can find subject matter experts, resources, and sometimes even funding to provide additional resources and support to your community. The first step is exploring your community data, because this helps you to understand not just the impact of the opioid crisis, but other health-related community concerns. One of the resources that we recommend for this step is the County Health Rankings from the Robert Wood Johnson Foundation. We also use data from county health rankings to inform the research of the project, because we really wanted to look at places that were having different experiences with the opioid epidemic. So not just communities that were hard hit and well of the impact of overdoses, but also looking at those where this is an issue that they still feel the effects of. As we walk through these examples, you'll see that these suggestions really do resonate across the public health concerns in your community. And you can use this approach to address more than just the opioid crisis. The second step is to consider your local assets. A great example of this can be found in the case study from the Kalamazoo Public Library. Kevin King, a member of the library leadership team, actively sought out ways to not only find out how the library could help, but also information to help inform decisions that the library makes. A key part of connecting with partners is being able to tell the library story. And this isn't always a place where we as library staff excel. Be bold, be clear, and be proud of what libraries can do. In meetings that we held with cross-sector discussions, one of the things that we heard over and over again was, I hadn't thought about libraries as partners, but it makes perfect sense, and I get it now. So some of the things we encourage you to emphasize are, libraries are trusted organizations that can reach diverse community members, helping partners to get to people they may not be reaching. You can talk about how the library is a welcoming environment to all. Libraries also have vetted topical resources, including books, journals, and databases. Think of the number of items already in your collections that can help reinforce the mission of local partners. And libraries have staff knowledgeable in curating and connecting people with community resources. Some of the local partnerships were local health departments, and they were the most common partners. Nonprofit organizations focusing on prevention, treatment, or recovery support were others. And at least half were involved in a community coalition to address substance misuse and the opioid crisis. Now, the next step is to increase awareness and knowledge of the issue among staff in the community. One of the biggest challenges with this topic is the stigma associated with opioid misuse. And that stigma can impact our biases, not just in the community, but within the staff as well. Helping to provide statistics and information about addiction and substance use disorder can help with lessen this stigma. And so it's really important to educate individuals about this crisis. And here are some resources that really can increase awareness. And this one fact of 12 to 17-year-olds who misused prescriptive opioids, 57% of them got them from a friend or relative, so from a trusted source. The genes that people are born with account for about half of a person's risk for addiction. So this is another fact that you can help people understand. The American Institute of Stress, as the emotional residue or strain of exposure to working with those suffering from the consequences of traumatic events, says that it really differs from burnout, but can coexist. So there's this emotional stress. It's not necessarily burnout, but you can have this emotional stress and also have burnout. And compassion fatigue is an issue for library staff, and it comes up with other topics as well. For example, during the Great Recession, library staff experienced compassion fatigue from helping people locate information related to filing for unemployment, assistance programs, housing options, and job seeking. The day that I followed the peer navigators at the library, that was very draining for me. I am very people-oriented and an extrovert in many ways. And I had planned to meet with friends that evening for dinner, and I had to cancel because I was just so fatigued and overwhelmed with that day that I experienced. This is very real to many of us, and we can see it now with the coronavirus epidemic. So I think there is stress in wanting to help people in our libraries, but also needing to adhere to closure orders for the community within the current coronavirus pandemic. It's knowing that the resources and programming that your library provides can be a lifeline to individuals who need social connection, either in person or through your public access computers. We can see how closely this is all connected when it comes to public health concerns. And the big issue right now with the pandemic with libraries is getting those physical resources and access to broadband. That's what we've also learned in this new research that we're conducting. And our last step in the call to action is the type of programming, resources, and services the library might be able to offer in connection with opioid misuse. And some of the examples are here. Displays with books, updating the library's website with resources, distribute free pamphlets, host a community forum or conversation, provide drug take-back events, and distribute naloxone. One of the interviewees shared this with the research staff, and it really speaks to the importance of both the research and what is happening within our communities. Through the call to action white paper and in presentations like these, we want to help more libraries and more organizations to find the opportunity to work together and help to address this crisis. So I will now turn it over to questions, and I will turn it back over to Edward.
Thank you so much for that wonderful presentation, Dr. Connaway. We do have some questions, but if you would like to ask any questions, please feel free to put them in the chat. I'm going to share my screen. And the first question stated, do you know of any libraries that are involved with the Healing Community Study, an NIH-funded multi-state program?
Um, we at OCLC were contacted about this study. I personally do not know the libraries involved. My colleagues in Web Junction are currently keeping track of this. Yes.
Someone else asked a question, where would you order a Narcan kit? Or
Most individuals in the library staff actually worked with either their public health departments or social services. And so I would suggest, if you're talking about from the library perspective, I would suggest contacting one of them, because I think that's the first place to start. If you're talking about yourself, if you want one personally, I would first look to the public library, and if they are not offering them, they will be able to lead you to the agency within your community.
we have another question. What partners can you recommend for an academic library?
Well, for the academic library, first of all, I would think about the services on campus for students. And so we know, and we've been learning this through our project looking at the coronavirus pandemic, that many students do not have homes. So they are homeless, they don't have shelter, they don't have food. And so I would work with I'd reach out to the campus student services to work with them. And I would work with the community as well, because the students are part of the community. So I would first partner with someone on campus and then contact the social services, public health within your communities. Because just because we're in academic libraries does not mean that we are not part of our local community. We are. And many of the students do live, if they're not just online students, they do live within our communities.
And we have one more question, and this will be our last question. And it reads, did any of the case studies address tension between the library and local politicians? I have experienced local government actively dissuading the library from addressing public health issues as overreach.
Yes, that's a really good question. Yes. And there was a large metropolitan library that had difficulties, and it came out on the local news, on television, with statements from the mayor, and that was very difficult. And this tension has been resolved. But at the time, that was devastating to not only the CEO of that library, but also to the library staff. And there's not only this tension between local politicians and library staff, and there wasn't a lot of that, but there was some. But what we did learn was the tension within the staff, because many, and I'm sure you've heard this as well, but some staff members, frontline staff members who we interviewed said, you know, I did not become a librarian to deal with these social issues. I don't feel comfortable dealing with addictions. I don't feel comfortable administering Narcan. So there's tension within the staff. And one of the things that we really have to think about and really address is that staff care. That is very important, because not only with this crisis with opioids, but also with the pandemic. So staff health, staff care, emotional health is very, very critical.
Thank you again, Dr. Connaway, for that wonderful presentation. It was a pleasure to have you with us this morning. We have a couple of more items to cover, and I just wanted to know if you could answer the questions in the chat. We have one question in the chat, but we need to cover the rest of the items on the program.
Sure, I will do that. Thank you for your interest in this project. And again, all of the information is available on the website, so please make use of it. This was a great study and a lot of people contributed, so thank you.